Emergency services workers in the parts of Buffalo City in Metro and Amathole district have downed tools. They are striking over a number of grievances, which include poor working conditions and staff shortages. But the health department deems it an unprotected strike. There are also reported incidents where 23 emergency fleet vehicles were damaged and even private ambulances pelted with stones. Abongile Jantjies is on the story for us.
The Eastern Cape Health Department has raised concerns over the strike that the emergency health services workers have embarked on. The department says this strike is illegal and they are not supposed to be on strike. This has affected the delivery of services, particularly in this sector. It is emerging in the Amathole and Buffalo City districts. The department says it's trying by all means to solve this situation. With me, I do have the spokesperson, Umnumzana Usizwe Kupelo. A very good day to you, sir. Services are affected by the strike of EMS workers. What can you tell us about that?
It's a very unfortunate situation. Yes, we view the action as illegal. As such, we are taking appropriate action. There are a number of interventions that we have since put in place, which include a court interdict. We are also considering the principle of no work, no pay. Of course, we continue to engage the relevant unions that our workers are affiliated to. We'll continue to engage, but at the same time, we cannot allow this situation. We are not going to sacrifice the lives of our patients. Their rights are very important to us, and we provide an essential service. Therefore, we need to always bear that in mind, that we provide this service, much needed service to our people. So we cannot allow this situation to continue. We have given our staff members ultimatums to return back to work. Failure to adhere to the ultimatum that has been issued, following steps will be taken. We have to act decisively in the best interest of our patients. Of course, we recognize the concerns that are being raised by the workers, but there are platforms, appropriate platforms, for those issues to be raised and handled. As such, our management will continue to engage, but we expect everyone to be back at work, and then we render the services. We cannot violate the rights of our patients. We cannot violate the constitutional rights of the public.
Part of the things that they are striking over are poor working conditions and shortages of staff. What can you say about that? Why did it have to lead to them having to embark on the strike without solving the matter?
Well, this is not the first illegal strike action. We experienced this in 2019. So there is a systematic way of looking at these things, and most probably you can even conclude that there's an element of actually sabotaging the service itself, because we have also noticed criminal acts which have since reported to the South African Police Services, because some vehicles have had tires deflated and slashed, and when we appealed to the private emergency sector to come in and close the gap, some vehicles were attacked, pelted with stones. We have also encouraged them to open cases with the police. We are also working with the police to monitor the situation. But where we are now, we are from negotiating with the relevant leaders, but at the same time, in terms of administration, we want to deal with this decisively.
Coming to the stoning of vehicles, and yesterday you said 23 of them were stoned. Has that number increased?
We have strengthened our security measures around the affected bases in PCM as well as Amathole, and we continue to monitor that situation. We've got South African Police Services on board, of course. There are processes that have to be followed in line with the policies of SABC. We've got to identify the culprits and lay charges against them.
You're saying you're far from reaching a solution to this matter, so how long can we expect for these services to be halted like this?
Hence the decisive action that is currently being taken. Administratively, we've got to act, and at the same time, we are running a public service. Therefore, We've got an open door policy where we need to engage with relevant people to try and find each other. But at the same time, we've got an obligation to ensure that we render services to the people, particularly when you render an essential service. We are also reporting those involved in this to the Health Professions Council of South Africa so that it can conduct its own investigation.
I thank you so much for your time, sir. Well, that was Sizwe Kupelo, the health spokesperson here in the Eastern Cape, saying that action will be taken for those who have embarked in this illegal strike. It has affected the delivery of services, particularly these essential services pertaining to the health sector.